Well, it's time for a health report, and joining us now is Africa 54 health correspondent Linord Moudou with the latest news on malaria. Hello, Linord.
Hello, Vincent. Malaria is a preventable and treatable disease. However, the illness kills roughly 500,000 people a year. Most are in sub-Saharan Africa and are under age 5. The disease is caused by Plasmodium parasites and transmitted through the bites of infected female Anopheles mosquitoes. Malaria can cause fever, headache, and vomiting, and can lead to death if it's not properly treated. The World Health Organization says malaria prevention measures such as bed nets and indoor and outdoor spraying have averted millions of deaths and saved millions of dollars in healthcare costs over the past 14 years across Africa. Worldwide incidence of the disease has declined 37% over the last 15 years, and deaths from malaria are down 60%. In Africa, annual malaria death has dropped from an estimated 764,000 in 2000 to 395,000 in 2015. But advocates say despite the progress, significant work remains to end malaria once and for all. Joining us via Skype from Seattle, Washington is Martin Edlund, CEO of Malaria No More, an international development organization that advocates for global malaria program. Mr. Edlund, welcome to the show.
Thanks very much. Thanks for having me.
So according to statistics, there have been some progress, obviously. What do you make of this progress?
I think we have to recognize this as one of the great success stories in global health. As you just pointed out, back in 2000, malaria was killing about 1 million people a year, 90% of those pregnant moms and kids in sub-Saharan Africa. Today, deaths have been cut 66% across the African continent, including 71% among kids. That's an estimated 6.2 million people that are alive today because of these interventions. So we've made tremendous progress. It's something that donors as well as African leaders should be tremendously proud of. But as you point out, we have more work to do. And in fact, we have the opportunity to end this disease if we seize it today.
So what will it take to end this disease? Recently, President Obama asked for a $71 million additional fund for the President Malaria Initiative, which will amount to a total of $745 million in the year 2017. What do you make of this?
So first of all, the U.S. has been a great partner to Africa in the malaria fight. Dating back to about 2005, President Bush established the President's Malaria Initiative, and also was the lead supporter in the Global Fund to fight AIDS, TB, and malaria. That was really the spark that started the progress that we just described. The good news is this is not a partisan issue. This is something that has spanned administrations, that has crossed party lines. It's something that President Obama has taken up in a high-profile way. As you just mentioned in the State of the Union, he recognized that we have the opportunity to end malaria this generation, and it's something he just asked Congress to fund in an increased way. Now, on the other side of that, we're seeing African leadership step up as never before. 5 years ago, African leaders banded together into something called the African Leaders Malaria Alliance. It's now 49 African heads of state that have committed to end deaths and ultimately eradicate the disease. So it's a great example of the partnership between the U.S. and Africa.
And quickly, before we end, because we're running out of time, it takes a leadership, of course, and clear goals when we talk about eradicating a disease. What are some of the goals, if you can just name a couple of them quickly?
Sure. The highest level goal is to end this disease in the next 25 years. If we do that, it would save an additional 11 million lives, avert 4 billion cases, and unlock $2 trillion in economic benefits for the world, most of that in Africa. So it's a big, ambitious goal, but it's something we can achieve.
It's not impossible. How do we keep the momentum going?
Well, leadership is key. Just a couple of weeks ago at the African Union, former Tanzanian President Jakaya Kikwete and Prime Minister Haile Mariam launched an op-ed, and they said that it wasn't long ago that in Africa without malaria seemed an impossible dream. Today, that dream's becoming a reality thanks to the most powerful weapon we have in the malaria fight, strong leadership. Okay. I think that's the first key. We need funding, we need innovation, but the good news is the tools are on the way to make that possible.
And we're going to have to leave it there. Mr. Edlund, thank you so much for joining us. And that was Martin Edlund, CEO of the international development organization Malaria No More.